Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about heart disease. In particular, I will cover what is heart disease, how you treat it, and how you can live more successfully with heart disease. So we start with what it is. Heart disease is a broad term used to describe a range of diseases that affect your heart, and in some cases your blood vessels. It is the most common cause of death in Ireland, accounting for 36% of all deaths. The various diseases that fall under the umbrella of heart disease include diseases of your blood vessels, such as coronary artery disease, heart rhythm problems or arrhythmias, and heart defects you're born with, such as congenital heart defects. The term heart disease is often used interchangeably with cardiovascular disease, a term that generally refers to conditions that involve narrowed or blocked blood vessels that can lead to a heart attack, chest pain, which is angina or stroke. Other heart conditions, such as infections and conditions that affect your heart's muscle, valves, or beating rhythm, also are considered forms of heart disease. Cardiovascular disease is caused by narrowed, blocked, or stiffened blood vessels that make it so your heart, brain, or other parts of your body don't receive enough blood. Cardiovascular disease symptoms can include chest pain, which is angina, shortness of breath, pain, numbness, weakness, or coldness in the legs or arms. If the blood vessels in those parts of your body are narrowed, a heart arrhythmia is an abnormal heartbeat. Your heart may beat too quickly, too slowly, or irregularly if you have an arrhythmia. Heart arrhythmia symptoms can include a fluttering in your chest, a racing heartbeat, which is a tachycardia, a slow heartbeat, which is a bradycardia, chest pain, shortness of breath, serious congenital heart defects. A defect you're born with usually becomes evident during the first few hours, days, or weeks and months of your life. A heart defect symptoms could include pale grey or blue skin, swelling in the legs, abdomen, or areas around the eyes, shortness of breath during feeding, leading to poor weight gain, and cardiomyopathy is the thickening and stiffening of heart muscle. In early stages of cardiomyopathy, you may have no symptoms. As the condition worsens, cardiomyopathy symptoms include breathlessness with exertion or even at rest, swelling of the legs, ankles and feet, bloating of the abdomen with fluid, fatigue, irregular heartbeat that feel rapid pounding or fluttering, dizziness, lightheadedness, and fainting. And next was heart valve disease. So the heart has 4 valves that open and close to direct blood flow through your heart. Valves may be damaged by a variety of conditions leading to narrowing, leaking, or improper closing. Depending on which valve isn't working properly, valvular heart disease symptoms generally include fatigue, shortness of breath, irregular heartbeat or heart murmur, swollen feet or ankles, chest pain, and fainting. So next is, how do you treat heart disease? Heart disease treatments vary. You may need lifestyle changes, medications, surgery, or other medical procedures as part of your treatment plan. Treatments for cardiovascular disease, the goal in treating diseases of your arteries or cardiovascular disease is often to open narrowed arteries that cause your symptoms. Depending on how severe the blockages in your arteries are, treatments may include lifestyle changes. So the lifestyle changes include eating a low-fat, low-sodium diet, getting at least 30 minutes of moderate exercise a day, and quitting smoking and limiting how much alcohol you drink. There's also medications. If lifestyle changes alone aren't enough, your doctor may prescribe medications to control your heart disease. These could include medications to lower your blood pressure, such as furosemide, tritase, and Atacor, blood thinning medications such as aspirin, or cholesterol-lowering medications such as Lipitor. So medical procedures or surgery. If medicines aren't enough, it's possible your doctor will recommend specific procedures or surgery to clear the blockages in your heart. A common procedure is a coronary angioplasty, which is performed by placing a catheter in an artery in your arm or groin and threading a small balloon to your blocked artery and inflating it to reopen the artery. A small metal coil called a stent is often placed in the artery during angioplasty. The stent helps keep the artery open. Sometimes a more invasive procedure, coronary artery bypass surgery, is necessary. In this procedure, the blocked portion of your artery is removed and a vein from another part of your body, usually your leg, replaces the diseased part of the artery. And finally, how do you live with heart disease? Heart disease can be improved or even prevented by making certain lifestyle changes. So stop smoking. Smoking is a major risk factor for heart disease. Nicotine constricts blood vessels and forces your heart to work harder. Control your blood pressure. Optimal blood pressure is below 120 systolic and 80 diastolic, as measured in millimeters of mercury. Check your cholesterol. Ask your doctor for a baseline cholesterol test when you're in your 20s and then at least every 5 years. Keep diabetes under control. If you have diabetes, tight blood sugar control can help reduce the risk of heart disease. Get moving. If you have heart disease, exercise helps you achieve and maintain a healthy weight and control diabetes, elevated cholesterol, and high blood pressure, all risk factors for heart disease. If you have a heart arrhythmia or heart defect, there may be some restrictions on the activities you can do, so be sure to talk to your doctor first. Eat healthy foods. A heart-healthy diet based on fruits, veg, and whole grains, and low in saturated fat, cholesterol, and sodium can help you control your weight, blood pressure, and cholesterol. Maintain a healthy weight. Being overweight increases your risk of heart disease. And manage stress. Reduce stress as much as possible. Practice healthy techniques for managing stress, such as muscle relaxation and deep breathing. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing heart disease more effectively on a day-to-day basis. To start with, we have numerous products to get you started on an exercise program, such as exercise balls, floor mats, weights, and various other items to get you up and running on a program we create together and is tailored specifically to you. We also have various supplements and products which you can purchase from us without a prescription, such as omega-3 fish oils, Omega, coenzyme Q10, psyllium husk, flaxseed, vitamin B and C. Plus we have light boxes to promote relaxation, blood pressure monitors, blood sugar monitors, and body fat monitors and assisted living devices. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of our brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing heart disease with confidence. We provide you with the tools you need to live a healthy life. Call in to us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.